Hello, I'm Molly, and this is Care Experts, brought to you by CareCredit and Pets Best. Together, the CareCredit credit card and Pets Best pet health insurance provide all the financial tools that can help you be the best pet parent you can be. Today, we are in Oakland, California with Dr. Andrew Moffatt. Dr. Moffatt is from Melbourne, Australia, and is the founder and CEO of VetnCare, a growing group of AAHA-accredited veterinary hospitals in the San Francisco Bay Area. Today, we are here with Dr. Moffatt talking about dog wellness exams and vaccines. Thank you so much for being with us today. If we can just start, can you tell us how often should our dogs have a wellness exam?
It's a great question. So typically we recommend that adult pets are seen yearly throughout that adult portion of their lives. Certainly puppies, adolescent, senior pets may need more frequent visits throughout those stages of their lives, but that would be our general recommendation.
Okay, great. And tell me, why is a wellness exam important for my dog?
I think it's important when we see a pet that's sick, we're obviously focusing on the condition the pet presents for, but the wellness exam is important because we're assessing the pet in its normal health state. It allows us to compare it to all the normals to identify potential changes that might alert us that there's a problem. Secondly, we can really focus on all the important aspects of a dog's life that extends their quality and length of life: nutrition, exercise, body weight, all those types of things.
And as a veterinarian, what exactly, when I bring my dog into you to have their wellness exam, what exactly is the process of an exam? What are you doing with the dog to understand, check it physically? What are you doing?
Well, initially we take a really good history to learn about the pet's lifestyle, its nutrition, its exercise regime, whether the pet is insured, the sort of stimulation, its environment, its training. Our veterinary nurses will then triage that pet and take all the basic measurements. Then I, as the doctor, would examine that pet nose to tail, a thorough exam looking at all the different body systems, and then together with the client would outline our findings and then put together a really solid plan to correct any issues we've identified. And then we touch on all the rudimentary elements of long-term health, reviewing nutrition, exercise, body weight, things like that.
Right, okay, makes sense.
Yeah.
And is there anything in particular you're looking for when a pet comes in for their wellness exam, bumps or lumps? Is there anything in particular you're searching for like that?
Yeah, I mean, as a doctor with a comprehensive exam, we're searching for anything abnormal. So certainly a bump or a lump would be something that would be abnormal. If it's been identified previously, we might compare the size to determine if there's been change there. Typically a bump or lump we would assess and determine what it is. But common things occur commonly. So just like in humans, we see high incidence of dental disease, obesity, arthritis, skin problems. So I suppose as a veterinarian, when I'm examining a pet, I am identifying those or assessing those areas to ensure that there's no disease in those different body systems.
Absolutely. Okay, now, so I know not all animals love going to the vet.
Yep.
Is there anything that pet owners can do to prepare their animal for a wellness exam?
I think so, yeah. I mean, it starts when the puppies and kittens are really young to ensure that they have a great experience. So we really focus on that behavioural desensitization training from early on. There's a number of initiatives out there. Our practices endorse fear-free, which is a concept around removing the fear experience from pets when they go to the veterinary hospital, and it makes them easy to examine. It also means their clients are less stressed with the experience. So there's lots of things you can do, but from a client perspective, it's really about giving your pet positive experiences at the veterinary hospital. And the veterinary staff can contribute to that. Treats, if your pet is food motivated, it really helps. The breed of dogs that likes coming to the vet the most is probably the Labrador. They literally bound in to see me because they're so food motivated and they know they're going to get a treat.
We'll be back with more Care Experts after this brief message from CareCredit.
Thanks to CareCredit, I can take care of my best friend. Thanks to CareCredit, I can smile again.
Thanks to CareCredit, I can be confident.
Thanks to CareCredit, I can prepare for veterinary care.
I can take care of myself again.
I can be myself again.
I can plan for Cooper's care.
I can take care of my pug family.
I can.
I can.
I can.
I can have peace of mind.
Welcome back to Care Experts. Let's continue our discussion with Dr. Moffatt. Okay, so when I bring my dog in for a wellness exam, is this a time I should be asking about optimal weight for my dog and how much I should be feeding my dog?
I think so. I mean, nutrition and weight control is a fundamental part of animal health, just like it is in humans. And so really as a client, your veterinarian should be asking those questions and helping you understand some standards around your pet's optimal weight. And so, you know, when clients come to our clinics, our veterinary nurse team will be asking some of those questions associated with history taking. So what diet are you on? You know, they'll be assessing the body condition score of the pet. They'll be asking about exercise routines and lifestyle. So once I've examined the pet, I can then give the client guidelines on how they might improve exercise routines or change lifestyle or adjust the diet to set that pet up for a long, healthy life.
So next question about a wellness exam, because, you know, when you take your animal in and they're receiving these vaccines, sometimes it's hard to keep track of what they're getting and why, or know what they should or shouldn't get. Can you just tell me what most dogs, you know, vaccine-wise, what they should be getting at each stage of their life?
It's a good question. It varies based on region and it also varies on different countries and even within regions, you know, different counties may have some different recommendations. So in this area, we sort of get our guidelines from UC Davis, which is an outstanding veterinary school that's local. AAHA, the American Animal Hospital Association, has fantastic guidelines for dogs and cats that are updated every few years to sort of give us some standards on which we can base our recommendation. Certainly around here, in dogs, rabies is mandatory. The distemper, hepatitis and parvovirus vaccine is not mandatory, but is a core vaccine that we would recommend. Around here, leptospirosis is really considered a core vaccine as well. Other vaccines that we consider around here, particularly for dogs that are socialising, which is most dogs. I mean,
yes.
Few dogs live at home in pure isolation, but the Bordetella and parainfluenza vaccine. And there's now a robust vaccine for canine influenza.
Okay, great. Can you walk me through a regular schedule for, you know, a puppy starting out and at what ages those vaccines should be given?
Yeah, so I mean, vaccines can start from as early as 4 to 6 weeks, but typically the protocol that we follow is seeing that puppy for the first time at 8 weeks of age when they will start their initial series of vaccines. They would then be boosted 3 to 4 weeks later. We're usually seeing those puppies as 12-week-old puppies. And then again, they'd get a third booster 3 to 4 weeks later at around 16 weeks. Now, the reason we do numerous vaccines early on is because when puppies first feed off their mothers, they absorb maternal antibodies. And those maternal antibodies actually destroy the vaccine. It's not until those antibodies wane that the pet will develop immunity. Now, we don't quite know when they wane. It's probably somewhere between 12 and 16 weeks, maybe as late as 20 weeks. So we keep giving vaccines, hoping that one of them is going to immunise the pet.
And as a veterinarian, can you describe for me what does a healthy dog look like? What is a healthy dog or puppy?
Well, I want to see some real spunk in that puppy. They should be lively and energetic. They should have good general mentation. They should be alert, responsive, and bright. A puppy should have significant outbursts of energy, but they'll also sleep. They're still growing, so there'll be periods of sleep and high energy. I want to see a healthy appetite. I want to see good weight gain. I want to see normal urination and defecation. As pets get older and move into sort of adolescence and adulthood, their ups and downs of sleep and energy will change. But I'm still looking for a dog that's energetic, responsive, bright, interest in its surrounds. They're the types of things I'm looking for.
Well, thank you, Dr. Moffatt. This has been really educational, and I've really learned a lot about why a general wellness exam that seems pretty basic is very important and can change a dog's life.
So important, the most important exam a pet can have. Yeah, my pleasure.
Thank you. Thanks for watching. All of our featured care experts recommend and accept the CareCredit credit card, which is accepted at hundreds of thousands of provider locations nationwide. And Pets Best offers comprehensive pet insurance plans that can cover up to 90% of your pet's unexpected eligible veterinary expenses. Together, CareCredit and Pets Best can allow you to provide a lifetime of care for your four-legged family member. For more information, visit carecredit.com.